Good morning, good afternoon, or good evening, everyone, and welcome to today's LactaHub workshop discussing the newly published Public Health Ethics Framework for Breastfeeding Interventions, a key component of EFBRI, an evolving ethical framework informing breastfeeding research and interventions. Thank you very much for joining. My name is Kutschkau from the LactaHub team. Today's workshop introduces the Public Health Ethics Framework for Breastfeeding Interventions and explores various potential applications during the experts' discussions. This workshop is brought to you by the Amref International University in Nairobi, Kenya, the Global Health Network at the University of Oxford, from the Forum for Global Health Ethics at the University of Zurich, the Institute of Biomedical Ethics and History of Medicine at the University of Zurich, and LactaHub. We have a very high number of registrations, and we are very happy about your interest. We welcome 500 registrations from Kenya, which are nearly over 1/3 of the registrations today. Thank you very much for your interest. But before we start, some housekeeping aspects. This webinar is being recorded and will be shared on LactaHub in about 2 weeks. If you cannot hear or see us, please check your computer or phone preferences or close and restart Zoom. If you still have any questions, please write in the chat. Our colleagues from the Global Health Network try to fix your issue and help you. Your camera is automatically deactivated and all microphones are muted. Please use the chat box to introduce yourself, but please use the Q&A section to post your questions and comments. We have a Q&A session at the end of the webinar and try to answer as many questions as possible. You can translate this webinar in your chosen language by using the closed captions functions in Zoom, where you can choose the language of the subtitles. We issue certificates of attendance after full participation, 80%, in this webinar and after completion of the feedback survey. We will share the link to access the survey at the end of this webinar. This said, I hand over to my lovely colleague from the Forum of Global Health Ethics, Tania. She will moderate this session, and I wish all of us an interesting webinar with loads of learnings.
Thank you very much, Kai. Good afternoon from Zurich, Switzerland, and welcome everyone. It is a pleasure to be with you today, and I am looking forward to hearing from our experts and learning together. My name is Tania Manríquez, and I am an ethicist and researcher at the Institute of Biomedical Ethics and History of Medicine at the University of Zurich. I am also the coordinator of the Forum for Global Health Ethics. This is an outreach project at the University of Zurich. We invite you to join our community. Just send us an email. You'll find it next to my name. Now, first, I will share with you today's 3 learning objectives. The first one is to understand the public health ethics framework and its 9 guiding principles for breastfeeding interventions. The second one is to learn how to implement ethical guidelines in national, regional, and hospital settings to enhance breastfeeding practices. The third one is to evaluate ethical considerations in promoting and supporting breastfeeding among diverse populations. Now, I am very pleased to welcome our international experts. We thank you for accepting our invitation to this event and look forward to learning from your insights. Let me introduce first Dr. Alice Lakati. She is the Director of Research and Community Extension, Amref International University, Kenya. She is a seasoned epidemiologist and public health expert with more than 20 years of experience. Dr. Nikola Biller-Andorno is the director of the Institute of Biomedical Ethics and History of Medicine at the University of Zurich, a collaborating center for bioethics of the World Health Organization. She is also Vice Dean, Innovation and Digitalization of the Medical Faculty, also at the University of Zurich. Dr. Faith Nawagi is a nurse and midwife and the African representative for the Educational Commission for Foreign Medical Graduates and its foundation, the Foundation for Advancement of International Medical Education and Research, Uganda. Faith Njeru is a pediatric nurse and nurse in charge of the Human Milk Bank, Pumwani Maternity Hospital, Kenya. Thank you all very much for joining us today. Now for our agenda. We will start with Alice, who will give us some welcoming remarks. Next, Nikola will present the public health ethics framework for breastfeeding interventions. After this, we will have a panel discussion on how to use this framework, EFBRI Part II, with Alice, Faith, and Faith. We will then open a 25-minute Q&A section in which I will read out as many questions as possible from you, our audience. We will end this webinar with some closing remarks from Kai. Now, Alice will welcome us from Amref International University. Alice, the floor is yours.
Thank you very much, Tania, for your kind introduction. Good morning, good afternoon, good evening. I'm very excited and honored to be part of this webinar. Importantly, Amref International University, which is a Pan-African university focused on training healthcare workers for primary healthcare, is excited to co-host this webinar with our partners, that is the Global Health Network, LactaHub, and the University of Zurich. I just want to take maybe 1 or 2 minutes to tell you about Amref International University that is co-hosting this webinar. Amref International University is a young university. We are 7 years old now, but we are not young in training. The university is born of Amref Health Africa that has been providing primary healthcare services in Africa for over 65 years. As a university, we have a strategic focus that one of them is to develop fit-for-purpose leaders for primary healthcare. We are saying that leadership is not a position, but is a sense of responsibility. So wherever our healthcare workers are, they make decisions for the communities, and hence the need for us to strengthen their capacity, not only in the science, in the skills, but also in making decisions. The university is also focused on providing a training ecosystem that promotes equitable access to health sciences education. As a university, we are cognizant that universities are full of health workers training, but there are communities who would never have access to healthcare if we don't train people from those communities. And that is why we intentionally are addressing the area of equity in accessing health sciences education to train primary healthcare workers. Our other area of strategic focus is driving evidence best practice for strong primary healthcare systems in Africa. We recognize that a lot of research or the ministries of health in our countries are not using local evidence for primary healthcare in advising decision making. And that is the area we want to contribute. There, finally, as a university, we have a training model that bridges the gap between knowledge and practice, so that our graduates, when they come out, they are able to connect with what is going on the ground. If you can go to the next slide. So therefore, as a Pan-African University of Primary Healthcare, the training of primary healthcare workers becomes important. So we have 2 schools, and we recognize that the training of healthcare workers in breastfeeding is very important. Our graduates from our nursing school, from our public health schools, gain knowledge and skills in breastfeeding, competencies to address challenges on breastfeeding, and support breastfeeding at individual, at facility, at national level. We also promote research on breastfeeding to provide the required evidence. And finally, as an organization, as a university, we lobby for policies that support breastfeeding. Therefore, for us, this webinar that is focusing on ethics or public health becomes critical, that we share this information, we work with our partners to ensure that more and more people are able to have the necessary knowledge and skills. So I welcome all of us to this workshop as we delve into the issue of public health ethics framework for breastfeeding interventions. I'm very excited that we have majority of people from our countries who we really want to build the capacity on. Welcome, and back to you, moderator.
Thank you very much, Alice, for these words. Now, Faith Nawagi will present a few slides for a general overview of breastfeeding in Africa. Faith, over to you.
All right. Thank you so much, Tania, and good morning, good afternoon to everyone. My name is Faith Nawagi once again, and I speak to you in the capacity of a nurse midwife practitioner, but also an experienced researcher in various aspects here in Africa, including maternal and child health, of which breastfeeding lies. The figures I'm showing you here really are from the WHO fact sheet on breastfeeding in the region, which was published in 2023. But then the data that is published here is from the years of 2015 to 2021. Africa is part of the globe, and with that, we are all subscribed to the WHO Afro region. And the WHO has sent 2030 targets in line to breastfeeding, whereby 70% of the babies breastfed should be breastfed within an hour of birth, and then 70% of the babies under 6 months old exclusively breastfeed, but also 80% of the children breastfed at 1 year of age. That is from 12 to 23 months. With all those targets set, where is Africa and how is it doing? We are at 53% for the percentage of babies breastfed within an hour of birth. 45% of the babies under 6 months are only being exclusively breastfed, while 67% of the children are breastfed at 1 year of age, that is 12 to 23 months. Moving to the detailed context of this, it's important to note that breastfeeding practices vary widely across the countries in the African region. Some countries face greater challenges than others. Now, looking at the map being displayed here, to summarize it for you better, only 9 out of 47 countries, that is 19.15% in the region, are classified as meeting the 2030 breastfeeding goals within 1 hour target. These countries include Cape Verde, Burundi, Eritrea, Ethiopia, Namibia, Rwanda, Sierra Leone, Uganda, and Zambia. However, in Chad and Congo, less than 30% of these babies were breastfed within an hour of birth in 2015 to 2021. Now, otherwise, only 2 out of the 47 countries that subscribe to the WHO Afro region, that is only 4.25% in the region, were classified as meeting the 2030 targets for exclusive breastfeeding under 6 months. And those are the countries coded as Rwanda and Burundi. With that said, it's very clear that interventions in line to breastfeeding, but also policies and frameworks that guide ethical implementation of the various interventions are key to be developed. So thank you so much, and over to you, moderator.
Thank you very much, Faith. Now I invite Nikola to present EFBRI Part II, Public Health Ethics Framework for Breastfeeding Interventions. Nikola, over to you.
Thanks so much, Tania. Well, I'm so happy to address you all as a medical ethicist from the University of Zurich in Switzerland. I've just been watching over the past few minutes the participants numbers mounting from 200, 300 to now over 400. It's participants around the globe. I'm watching the greetings in the chat. So I think this is really amazing. I think it shows how important the issue is to all of us. I'm really looking forward to be engaging with you in a discussion, to be hearing your questions later on. So before I get started, on the next slide, you see a brief disclosure. The development of EFBRI, that is the ethical framework informing breastfeeding research and interventions, parts 1 and 2, and the related research projects were actually funded by a grant from the Family Larsen Rosenquist Foundation, and we are very grateful for this support. So I think we can delve in the framework that I just mentioned, the evolving ethical framework informing breastfeeding research and interventions. It's a little unwieldy as a name, and that's why we call it EFBRI, is available on the LactaHub website. You see the link on the slide. You can access it anytime you want. And you see on the website, there are really two parts of this framework. Part 1 is the research ethics framework. So that's for lab research, for clinical trials, etc. So it covers issues such as ethics committee review, the use of placebo in control arms, how you deal with genetic data, etc. So classic research ethical questions geared towards research in the field of breastfeeding, lactation, and infant nutrition. And this is not what we will be discussing mainly today. Part 1 has been covered in previous webinars. Today, we will focus on part 2. We don't have to move yet forward with the slides. I think the past slide was still, thanks. We will discuss part 2, the public health ethics framework today. So that's about breastfeeding and lactation interventions that may or may not be accompanied by quality control measures, by evaluations or implementation research efforts, but it's really about the interventions that may cause ethical issues and we want to look at today. So this public health ethics framework has 3 aims. It's really about helping policymakers evaluating public health breastfeeding interventions that meet the needs of diverse, vulnerable populations. So you can imagine people sitting in ministries of health, for instance, thinking, do we want to choose such interventions? What would be the ethical implications of this? And we want to provide them with a document where they can briefly get a first orientations as to what these ethical issues might be. But we also want to, secondly, guide those who are actually doing the implementation. So those who are actually working at the front, implementing breastfeeding interventions and who might think, oh, something's not so great here. I see certain issues. You can also look up this framework and see if there's anything that gives reason for why you might be feeling uncomfortable or, on the contrary, delighted with a certain program. And so we hope that this will really help our text to evaluate ethical considerations that are linked to promoting breastfeeding and counseling breastfeeding women. We just heard from Faith Njeru how important such interventions are to bring up breastfeeding rates around the globe. But of course, we have to do so in a way that's ethically well reflected and that preserves the respect for autonomy, that minimizes risks, that optimizes well-being. And you may have observed that the first part that I just mentioned, the research ethics, that's so much regulated in many countries. We have lots of rules, lots of documents that cover human research, right? But interventions are much less covered. And we think there is also a need to address those issues. And this is why we have decided to dedicate the second part of this framework specifically to public health ethics and public health interventions. And we hope to fill an important gap this way. So now the next slide, please. And you see, this was a process. We started out with our work around the year 2021, when we issued the first version of the research ethics framework. We then did a number of webinars. We had important discussions with our audiences. And now version 2 of this research ethics framework has become available this year. Now, in around the year 2023, we started to work intensely on this second part of EFBRI, so the public health ethics framework, the focus of our discussion today. And like we did for EFBRI 1, we are now looking forward to the discussions in this webinar beyond, so to really get as much input as we can, and then hopefully also produce a new iteration sometime from now that may be still, better informed about global realities around the globe and still richer than the current version. So you see this arrow, this is not the end where we are now. These are all learning documents that crucially depend on feedback from the community to be as good as they can be. So we hope that together, parts 1 and 2 of EFBRI will help safeguard ethical standards in efforts to achieve equity in breastfeeding and improve breastfeeding practices, as well as maternal and infant health. On the next slide, you can again see this little illustration to see when you would want to look up which part. So the first part is really when it's about research with breastfeeding mothers or children, and research really meaning the method-driven search for generalizable knowledge. So imagine you have a randomized controlled trials, if bottles, cups, or dummies work best in terms of still maintaining the breastfeeding capacity of women. And if you have to kind of feed preterm infants though with bottles, cups, or dummies, you want to figure out which is the best method. You design a trial, you perform this trial. The ethical issues around this would be covered in EFBRI Part 2. On the other hand, you might be designing an educational material on family planning, on the importance of breastfeeding, on maternal and infant health. You might be establishing peer counseling, for instance. These issues would be covered as public health interventions in EFBRI Part 2. Now you might say you may also have public health interventions that are accompanied by a research component. That's very true. And this is why we think, you have to think of the framework as, having 2 parts under one roof. And if you feel your public health interventions comes with a research component, you may also want to consult EFBRI Part 1. On the next slide, you see that EFBRI does, of course, not sit in a vacuum. It's situated within a landscape of different policies that have been issued at different levels by different organizations. And we've displayed a selection of those on the slide. We could have added more. For the research ethics part of EFBRI, for instance, we could name documents such as the SIOMS guidelines that govern research ethics, the World Medical Association Declaration of Helsinki, importantly. For Europe, we have the so-called Oviedo Convention. So there's a number of relevant research ethics frameworks that are compatible with and have informed this first part of EFBRI. Then, of course, importantly, there's the Universal Declaration of Human Rights. You see this on top of the slide. And just by the way of an example, for instance, Article 25 of the Declaration says motherhood and childhood are entitled to special care and assistance. But there's also Article 12 that says no one shall be subjected to arbitrary interference with his privacy, family, home. So there is privacy and there is the well-being of mothers and children. And you already can sense the ethical tension, of course, that we want to have as many infants being breastfed and get the best possible nutrition as possible. We also want to respect women's choices. So there is a need for an ethical framework that can help us walk through these difficult issues in a structured and well-argued fashion. And then there is, of course, a lot, and you see these on the right side of the slide, of other texts that are relevant, such as the technical guidance that is provided by various international organizations, WHO, for instance, UNICEF, which emphasize breastfeeding as a global health priority and that give guidance, how many months exclusive breastfeeding, etc. So really technical guidance on the issue. We might want to mention the United Nations Conventions of the Rights of the Child. You see the abbreviation here, CRC, that, for instance, stipulates that states shall ensure to the maximum extent possible the survival and development of the child. Or we could think about public health ethics documents, different sorts of guidelines that have been issued, for instance, by the World Health Organizations on ethical issues in public health surveillance, as one example, that deal with issues such as how do we handle data that are collected for public health purposes, etc. So EFBRI is really a piece of that puzzle, but we hope it's a fitting piece and one that has been missing so far. On the next slide, we describe a little bit the process, how we develop this framework. We may want to move to the next slide if that's possible. So how did we go about developing this public health ethics framework? We started out with a scoping review. That means we went through the literature to capture the key elements of the current ethical discourse regarding breastfeeding, lactation, and infant feeding practices and interventions. This means we read thousands of abstracts and found a number of substantial papers that discussed relevant ethical issues, such as the potential tension between maternal autonomy and informed choice, and the outcome of breastfeeding programs, the risk of stigmatization, for instance, either way for breastfeeding or for not breastfeeding, the ethical acceptability of financial incentives in breastfeeding interventions. So a broad range of issues that were covered in this body of literature. That was our first step. In parallel, we looked at studies that described actual interventions, and we looked at the ethical issues that came through in the description of these interventions. And based on those two bodies of literatures, we drew up a first draft that we then presented to 12 internationally renowned colleagues in the fields of neonatology and human lactation research, in the field of midwifery, breastfeeding consultation, gynecology. We also presented it to milk bank managers, bioethicists, women rights experts, anthropologists, public health experts, and child nutrition experts. And based on that input, we produced the version that is now available on the website. And before I get to a brief outline of what's in there, I would like to invite you to answer the following question that you see on the next slide. In your view, which would be the most important ethical considerations and problems to address in such an ethics framework for breastfeeding interventions? I would like to invite you to just pause and think and make a note to yourself. Or you can also, and our organizers will help us do this, note your thoughts and make them available to us. This will be delivered in an anonymous way, so we can then work with your input, because we think it's very important to get your expectations and the things that you think would be really important to cover. So, and I'm inviting our organizers to maybe instruct our audience how they can, if this is feasible at all right now, how they could either, and I see it's appearing now. For me, I've seen a poll appearing. If that's the same for you, you can either answer your question in the poll and post it. It won't be visible here in the session, but we will be able to see it afterwards and work with your input. Or you can also just, think about it, scribble it down on a piece of paper, and then, because then you can compare what I'll be saying with what you thought you might be hearing, and this might help you maybe formulate a question for the discussion later on. So I will pause for like half a minute to give you an opportunity to think about this question, and then I'll continue. Right, I hope that most of you have had an opportunity to just, do a very brief brainstorming. You can also, of course, continue taking your notes while I'm speaking. You will now see the areas that are actually covered in our framework, and that's visible on the next slide. And you can have a look now and see, is my topic covered? Now, be aware it might be hidden under, these titles. But if you really don't find it covered, make sure you bring it up later on. And now I've been wondering in the short time I've been allocated how I could actually be, telling you about what's behind those, 9 labels that you see here. And of course, it would be horribly boring if I now walked through them one by one and told you what you can, of course, read in the document. And I'm inviting you to maybe, if you have some time, go through the document in detail and look at the sections that interest you, or read through the entire document. But now we'll have to be a little more selective. So on the next slide, you will see an example. Imagine the intervention we have in mind would be designing and implementing a home visit program by breastfeeding and lactation consultants. Now, let's go through what those principles or areas might mean. If you enter a person's home who's just been giving birth, of course, you have a vulnerable mother, you have a vulnerable infant, and maybe also a family that's a little stressed, and, things are new, things are changing. So there is situational vulnerability very clearly. You also see that, of course, it depends on where we are talking. Are we talking about entering a home in Switzerland? Are we talking about entering a home in Ecuador? Are we talking about entering a home in Kenya or some other place? In some contexts, let's say an urban context, maybe it would be fully accepted that a woman does not want to breastfeed, or it might be, on the contrary, it might be particularly in an urban context, be expected from her to breastfeed, whatever. So we need to be aware of those factors to see where people's vulnerabilities might lie, to make sure we design such a program in a sensitive way. You also see this label, health promotion and communication. You might wonder, well, what can possibly be ethically complicated or sensitive with health promotion and communication? But of course, there's lots of stuff that can go wrong in the effort to promote health. We can be manipulative, we can be deceptive, we can be overly eager to enroll people even though they don't want to. So that's important to also bear in mind. We need to make sure we get informed consent. I'll get to this in a bit more detail in a minute. We'll also need to wonder if there are conflicts of interest that might push us to maybe go a little too far. Maybe, this could be financial incentives. It could be other incentives. So reflecting on, are there any secondary interests that may undermine the primary interest of, serving this program well, that need to be reflected, that need to be managed. So those in bold would be the areas you see that you might want to explore with first priority. And then there are also others that are nevertheless important. Responsibility and accountability, for one, it looks like a little sober title, but it stands for the necessity for stakeholders to assess the safety and effectiveness before implementing interventions, and then also assume accountability for such a program, and to transparently justify the choice of an intervention. Why do you go for, let's say, home visits rather than doing something else? You want to have an answer for that as maybe the authority that selected this program over a range of other options. I also already mentioned incentives as potentially creating a conflict of interest. It's an open question to what extent. We can stick with the previous slide for a second. But it's also a question, for instance, if participants shouldn't receive some kind of compensation. Our framework speaks to that issue. Then The minimization of risks and equitable distribution of risks and benefits is another important issue that may not be so prominent in that case, but it's also an issue. What population do you target? Are some people left out? Why would we go maybe to those who are more easily accessible, although we know that those who are more remote would benefit maybe even more? So these would be important issues to clarify before fully defining and fleshing out such a program. And then if we realize something really worked well, it would be somewhat unfair to say to that community, we know it works, we've tried it out for some time, we've started it, and now we are leaving it and we're abandoning it, although we know there is important benefits to be reaped. So that's also something to see, well, what would happen after the intervention has ended? On the next slide, just very, very briefly, an example. If we now delve a little deeper into one of those fields, and I've now chosen informed consent as an example. If we zoom in a little more, what would our framework now say about the example of informed consent? So you see here, the text reads, public health officials, researchers, and all stakeholders involved in implementing interventions must develop culturally appropriate ways to communicate information. Ensuring individuals' privacy and confidentiality of information is essential unless there is an overriding moral concern justifying the release of such information, etc. So you see, the privacy is a key moment. Even if you enter a person's home to counsel them, you want to make sure they consent to this. And you might want to say, well, it's for the public health's good. But if we remember the times of the corona pandemic, for instance, where public good was quite prominent, even then we had very controversial discussions of what's possible and what should be done. For instance, remember this discussion around COVID trackers, where people's movements were tracked to see, how we could best avoid the transmission of the disease. And we had very controversial discussions around the issue of what data you may save. This is to say that also in this context where you enter someone's home and give consultations, you want to make sure you heed the principle of privacy, because and then, of course, there might be reasons maybe to also do things without consent. If you realize, for instance, there is impending violence in the household that you enter, then maybe you don't need anybody's consent to be calling in the police. So these are important issues to be negotiating and to be aware of. And this can now happen, the consenting, at two different levels. It can be if you recruit individuals and you use or collect their individual data, this would be at the level of the individual where you need to get their consent. But in addition, it might be prudent to involve the community in the decision on an intervention and in how to deliver it. Such community processes, and that's what it says in the text, however, may not supersede individual consent. So you may not just consult someone from the community and then say, oh, I don't have to ask the individuals because I already asked the community. Our guidelines are aware that the scope of when you may refer to public authorities, for instance, and when you need to ask individuals is something that's the subject, again, of controversial discussions. So, and this is nothing that the framework can solve itself. So, for instance, if there is, we talk about fluoridization of drinking water, this is nothing for which you have to get each individual's consent. This is something that's decided at the community or even a national level. But there are issues where you have to negotiate if you need individual and or community consent and or involve public authorities. And our framework, and this already points to the limitations, cannot give definite answers for all contexts, but it can list what issues you need to consider in trying to maneuver this program well.
Nikola, sorry to interrupt you. Should
I'm
we
ending.
wrap up?
I'm wrapping up. Thank you, Tania. Yes. So last slides, and just to say, what we hope to deliver a globally applicable ethical framework. It will need to be enriched by input from various communities. This is why I think this meeting is highly valuable. It's an evolving framework, and on the last slide you see our messages. It's an ethical framework. This is not a legal text. It's not a code of conduct. So there is room for specification interpretation. Of course, context matters. It's not everywhere. It's not that everywhere issues are discussed the same. It's complementary to national laws, good clinical practice, and safety standards. It does not replace them. And it's a living document that involves those who are interested in contributing to protecting and promoting women's and infants' health. And with that, I'd like to thank you for your attention. And particularly, I'd like to thank my team that's helped me put this together. I'd like to thank the team of the Family Larsen Rosenquist Foundation. And I'm really looking forward to the input of our panelists under the questions of our audience. Thank you.
Thank you so much, Nikola. Now, if you or audience have questions for our panel, please post them in the Q&A window below if you joined on Zoom, or send your question to the Global Health Network via Facebook Messenger if you joined on Facebook. Now we will begin the panel discussion. In this section, our experts will share their perspectives on how to use the public health ethics framework for breastfeeding interventions. I would like this section to work as a conversation, so do let me know if you'd like to comment after another expert's intervention. I would like us to start this panel discussion reflecting on a feature that Nikola mentioned in her presentation and that seems to be key. This is the context in which the framework is applied. So I would like us to begin this discussion answering this question. How do you think the principles of the public health ethics framework for breastfeeding interventions can be used in your professional context? Now, if you could also briefly describe the context in which your work takes place, that would be also very, very helpful. So who would like to start answering this question? Faith or Alice?
Thank you very much, Nikola, for taking us through the framework. And I must say that it's timely. And if I look at my context, as a university lecturer, this framework is very important because we are training health workers who are really going to be implementers of programs of breastfeeding. We are training researchers at various levels. So for us, I see the application of this framework in training, whereby we incorporate this framework into our curriculums so that we don't make assumptions that breastfeeding interventions, less ethical considerations, because I think the framework has really taken us through the aspects about vulnerability, because many times you don't really think about that in that context, because we think more about the clinical work or another field. So I see that really working well in the training section at all levels. Majority of our students are nurses, public health people at various levels. So we are going to really incorporate this into our training curriculums. And also this webinar has helped highlight it. So let me pause there for now.
Thank you, Alice. Faith Nawagi or Faith Njeru, would you like to add something? Yeah.
Sure, I'm happy to add something. So for me, my work spans between three domains: the clinical or the frontline, those that are really giving the care, the research bit where I heavily involve my brain as well to develop research proposals and things like that, but also in the academia realm and policy realm across Africa in the realm of health professions education. So for me, I want to look at this in the context of Africa as a region. And when we look at how can this be implemented within our resources that are limited, but also that even if they are limited, they are still really contributing to advancing healthcare and things like that. So I would like to think of this as something that should adopt the participatory approach of really adapting it, but also having meaningful conversations with those that implement these breastfeeding strategies at the front line, especially the postnatal wing in line to the hospitals and things like that, to really understand, while this framework has been developed and it's important, isn't there a protocol that our countries or our different centers are using to implement breastfeeding interventions and all that? If that exists, how does this framework complement what is existent in terms of where is the gap, but also where is the strength, or where is that shared common agenda? And then that way it can be appreciated by the locals if we have them engaged with a participatory approach of, advancing these use. Of course, giving the academia world and the research bit and things like that, I like that many countries today have a very well established ethical guidelines in terms to research or interventions that are related to human subjects here in Africa. We have a lot of institutions that we call IRBs, which should be accredited and things like that. So having them, because their role is to really emphasize the principles of human ethics or medical ethics, which are mainly 4, but this framework speaks more to the reality of implementation of these ethics in the realm of breastfeeding. So maybe an extra layer that can be added as a point of attention when all researchers are developing their consent forms or their ethical guidelines and frameworks of how they are going to do their interventions, to pay attention to these different perspectives. This framework, quite frankly, if you look at it, provides a more detailed practicability of really advancing the 4 main bioethics principles, of which breastfeeding also subscribes to. Over to you, Tania.
Thank you, Faith. Thank you very much for your intervention. Faith Njeru, would you like to add something?
Yes, thank you for this opportunity. And therefore, in my line of duty and work, I am a pediatric nurse working in a neonatal unit and more so doing lactation support and also spearheading the first human milk bank in Kenya. And therefore, I would really like to talk about breastfeeding as one of the intervention that is really powerful when it comes to the care and the management of the newborn babies who have been born. And therefore, looking at the principles in this framework, then I find them to be an addition to help support and spearhead the breastfeeding support within the mothers who've just delivered, and more so probably looking at the health promotion and communication that is most of the time overlooked by people when they are developing guidelines, because until the health promotion involvement of the community when talking about breastfeeding and involving the community, so that you're also able to understand their cultural, their social values and what they believe about the uptake of breastfeeding, and then the right communication to the mothers and the clients that we are serving in a manner that we are giving them accurate information in a respectful manner, and as well as communicating effectively. Over to you, Tania.
Thank you, Faith. Thank you so much for your answers to this question. I find them very, very helpful. So here's another question for you. So how can the public health ethics framework for breastfeeding interventions help to solve ethical problems that arise in breastfeeding programs? What do you think about that?
I'm happy to go first if that's okay.
Please go ahead.
So for me, such a framework, now I'm going to wear my HPE lens or health professions educator lens, in the sense of that what's a framework? Why are we even talking about a framework? Not a protocol, not a fact sheet or a guiding principle and things like that. So when I bring it to that perspective, a framework gives a detailed understanding of a particular topic, a detailed way of approaching how to address something, a well-intended objective and outcome, but also it provides the practical guide in the aspects of implementation and things like that. So for me, what I see in this, it's because it's a framework, it's pointing us back to the principles of the biomedical ethics, beneficence, maleficence, autonomy, justice, and things like that. So with that, coupled with why a framework and why is it that we should use it in that perspective, then it helps to really emphasize the basics of the biomedical ethics, but also with an all-round practical lens that should be applicable at various levels. Over to you.
Thank you, Faith.
Right.
Alice, would you like to add something?
If I can pick from where Faith left, I want to wear another lens. I sit in the ethical review board, whereby we receive protocols and we review various protocols before they go to the National Science Council for a research permit. So ethical review boards are very critical in supporting, or the way you asked it, solving ethical problems in breastfeeding or adherence. So the ethical review boards play a critical role in this. And therefore, one of the activities we undertake is continuous capacity building for various review committees, because in Kenya, we have a number of ethical review boards, and therefore we continuously go for additional training, and we bring this to the attention of other members in form of seminars or webinars, just to strengthen our capacity to be able to be cognizant about new development in the fields of ethics. So therefore, this framework really becomes important as one of the frameworks that comes into play for this particular purpose in our context. The other area is working with the policymakers to ensure that this is also one of the frameworks that is well positioned, because if you look at the other frameworks for ethics, they are being elevated, people have been trained on, and therefore there is now an opportunity for us to advocate for strengthening the policies or strengthening research in breastfeeding, so that the framework really helps us in shaping out how we work. As I think Professor said, is not really, it is a guide. It is a tool that we are going to look at it in our settings. How does it work in our various cultures, and how does it add value? So I see this as one way that we can utilize this framework from where I operate from. Back to you.
Thank you, Alice. Thank you so much. Nikola or Faith Njeru, would you like to add anything?
Maybe briefly. Sorry. I'm delighted to hear that you see potential for education there. And I think that's so important, because what sometimes impresses me coming from ethics is how often we think about research ethical issues in so much detail And that's good and important. We absolutely need to do this. But then once the research is done, and when it comes to intervention, or when even, there is an intervention that has never been tested in research, we just go ahead and introduce it. There is no real ethical guidance as to how to introduce something. You just mentioned the issue of health promotion, for instance. Who's checking those leaflets? With what kind of systematic approach? So I think the idea of maybe using this in some suitable way for educating future public health people, for educating nurses, would be lovely. And I think the framework might serve as a basis for different formats. If you think a checklist is better and no one's going to read a lengthy, kind of document that's, not written with a view to accessibility mainly, right? There could be different formats produced based on this. I've been thinking, in preparation of this panel, I reread this convention for the rights of children, and it's a horrible text to read, but there are different ways of displaying it for different target groups. For instance, they've produced a version for children. UNICEF has done that. So children can read the convention, right? And there are other that are maybe more appealing to a younger generation. So you can use more illustration, make it more lively, make it not lose content, not lose depth, but just use different ways. And maybe this, if we consider the framework kind of as providing the basis for very different formats that might spring from that, this might be a way of going about this and making it still more useful to different communities. Thank you.
Thank you, Nikola. Faith Njeru, did you want to say something?
Yes, thank you, Tania, and probably echo to more what Dr. Alice talked about guidelines and policy adherence, and looking at the ethical problems that may arise in breastfeeding programs, because although other peoples believe that there are other forms of feeding their babies, and if there are no written guidelines and policy to safeguard them the breastfeeding, then here comes and arises then the conflicts of interest that may arise when it comes to mobilization and probably trying to keep people up to speed and understanding the breastfeeding policies. And therefore, I think with this also framework, then it is going to shield the breastfeeding practices in a manner that then every person and every mother or babies, then they will be able to receive the best practices. Thank you.
Thank you, Faith, so much for that intervention. And on that note, I would like us to put an end to this very interesting panel discussion so that we can start the Q&A section with our audience. So if you have more questions for our panel, please post them in the Q&A window. I think this is a very good time to thank our audience for joining today. We currently have 457 people on Zoom, and many other people have joined on Facebook. So thank you so much for your interest. So we aim to answer as many questions as possible. If we cannot answer them all, we will save them and try to provide written answers along with a recording. We have some questions coming in. I will start with this one. So what modifications have you made or would you like to make to the public health ethics framework to adjust it to your cultural context?
Sure.
Any modifications?
Yeah.
Faith, yes, please.
Yeah, thank you so much. I'm going to speak to work that we are doing with Lacta Media, but also seeing how this framework is really applying to the kind of intervention that we are trying to really develop.
Yeah.
So many times I'll speak to why we developed this and how we wrote it in the protocol and things like that. So many times when we develop media to use for breastfeeding health or health education or educating those who are yet to become health professionals or the mothers and things like that. Many times here in Africa, we may be short of images to the African ethnicity in line to a particular breastfeeding, let's say pathology or breast position and things like that. So with that, we've worked with Lacta Media and Family Lesson to develop the African ethnicity Lacta Media images. But this is kind of different. But the fact that it has human subjects involved and things like that, we had to go through ethical approval and do what the country requires us to do for any intervention or research in line to human subjects. This is an aspect that the framework emphasizes, but also going forward to do the aspects of informed consent, paying attention to the vulnerability of the population that we are working with, which is still an aspect that this framework is paying attention to, with the fact that the mothers, especially the children, really are young, so they need an aspect of assent and things like that, but also effective informed consent process with the mothers as they consent to participate in this project and things like that. It is something similar to what the framework is suggesting, but how have we adopted it? We have made sure, as the framework says, the context, we have translated the consent forms to the local language that the mothers here in Uganda use and things like that. But also paying attention to the aspects of after the intervention, what next? I like that this framework thinks of post-intervention and how do we remain accountable. I think this is something that we've clearly brought out to the mothers, that these images are for medical use and things like that. They also have a will to withdraw their image at any one point in time, and thus paying attention to the aspects of autonomy, but also paying attention to side effects. Our IRB was really saying what side effects would come out of this, the aspects of privacy and all that, so paying attention to blurring people's identity and things like that, but also the light as we take the images. This is something that we thought we are not intervening, we are just using cameras and things like that. But the aspect of light is something that we had ignored, yet some people, that whole taking images really affects them. And if it's too colored and occurring at different times, it could trigger an epileptic, reaction and things like that. So how am I really trying to summarize this? The Lacta Media project that we are doing here in Africa is in line with these principles, and we are piloting as we move forward, and I think it will be wonderful to see what's more practical at the end of the day. Yeah.
Thank you, Faith. Thank you so much. Alice, did you want to add something?
Maybe just to say that within our ethical review committee that is regulated by the government of Kenya, the principles that are in this framework are already actually addressed. If you look at the aspects about vulnerability, the framework talks about breastfeeding mothers. It talks about, if I look at, for example, studies that are looking at teenage mothers who are breastfeeding, this is already a vulnerable group. And therefore, this framework is already emphasizing the needs that special care should be taken on them. And therefore, already the process that we are using, research that is addressing young people or vulnerable groups like young women, they're already taken care as a special group. But I also like that the fact that this framework emphasizes what we are already looking at, because sometimes sometimes they can be excluded from benefiting from an intervention that is good. So therefore, this framework then really adds value to the already existing framework of ethical review of studies that are dealing with vulnerable groups. And this is a vulnerable group that you are dealing with when you talk about breastfeeding women, particularly the first few days, the first few months. And I think Faith, who works at Pumwani Maternity Hospital, is really in touch with that group of women who are really vulnerable. So inputting that already exists becomes important, which we are already doing it. And this is really helpful that it has come to light. And thank you, Nikola and team, for highlighting this.
Thank you very much, Alice. I have a very interesting question here for Faith and Faith. The question goes, how can working mothers who still want to exclusively breastfeed be supported? This is a very difficult one, I guess. Do you want to answer it, Faith or Faith?
Sure, I like that we are two faith. I think there is value in this framework to have
there is.
Faith, you know, so we are on a good deal that, yeah, we have established some trust because we are two faiths. Anyway,
Exactly.
Putting that aside, I think that's a good question. Mothers face a challenge here in Africa, as for that data from WHO, to do exclusive breastfeeding, largely because of today mothers also work, so they have to go back to work and things like that. But also the various societal barriers in line to not really having sufficient help and things like that as you go through this whole transition of breastfeeding and ensuring it's exclusive and all that. But so now what interventions can be done to address that? I've seen something called the CREO project here in Uganda, something established by our National Social Security Fund. CREO project has been one of the model centers here in Uganda that has developed a child development and support center at the workplace. Mothers come with their babies, take them to the child support unit, ensure that they breast pump the milk, and then the milk is well kept in a sanitized way and fed to the baby, or the mother takes a break and then they go and breastfeed the baby. I think if all workplaces can adopt something like that, I think that would be very helpful. I know it's resource intensive, but we can always start somewhere. Another aspect that I think could help mothers really practice exclusive breastfeeding. This is something that I've seen practically and things like that. Many times when you go back to work, I think some mothers don't know the aspects of breast milk pumping in the African context. I'm just talking about the African context, especially those in the rural areas. I wish they could be taught how to do breast milk pumping, you know, and how to sanitize it well, to ensure that it is safe for the baby as they leave to go for their work, so that they leave it behind for the caretaker to use. I think that aspect is missing for the modern day woman in our age groups and things like that. They're able to do that, but that's not the majority of the African population. So how to do it in a cost-effective way, but also in a very health sanitized way is key. Over to you, Faith.
Thank you, Faith, for bringing that, because actually that is part of the contribution that I was to give, you know, working in a lactation support center where we want to support these mothers all the way from the hospital and even into the community. And probably something that most of the people are not aware, that there are policies also within the countries that govern and help mothers who are breastfeeding, so that they are able to optimize and achieve exclusive breastfeeding, so that we are also able to see a higher percentage of babies who are being breastfed, you know, looking at the graph that Faith shared earlier, and early initiation of breastfeeding is also able to, if the mother is able to.
Sorry, I'm not hearing you very well. Can you repeat what you just said?
Sorry for that interruption.
Oh, no worries.
What I was So what I was saying is for a mother to be able to achieve exclusive breastfeeding, all this comes all the way from the delivery by initiating the lactation within 1 hour so that this mother is able to optimize lactation and to achieve the maximum lactation, even for her to be able to lactate up to 6 months. However, also adding to Faith what she says that workplaces should be able to support lactation mothers immediately after they are back from probably the maternity leave that in most of the countries, it goes up to 3 months. Then they are able to have spaces or a place where a worker can be able to go express, and storage facilities, the fridge and the refrigerators for them to store their breast milk for their mothers. Then that one can be of a great help. And as well as putting into consideration that is the employer also able to add more breaks to this lactating mother when she's at work, so that she's also able to go and express the breast milk for her baby. Thank you.
Thank you very much, Faith. We have here another question that goes, how do we address the issue of breastfeeding in teenagers, especially affected by stigma leading to depression, which has to be addressed under the public health ethics and compliance? So how do we address the issue of breastfeeding in teenagers? Faith, yeah? Nawagi?
Yeah, thank you so much. I don't want to appear like I'm over-dominating, but regardless.
That's great.
So, yeah, I feel teenagers are also, the fact that they are now mothers, then they fall in the aspect of requiring to go through the whole process of teaching them about breastfeeding, the importance and all that. But I also understand the stigma that comes with it, especially here in our setting where you even have to go out of school and things like that.
Yeah.
I would like to speak to an intervention that I think is amazing here in Uganda, but it's capital intensive, please note, but it is something that is unique, being done with our own setting, with our own limited resources here. It's called Ata Milk. It's a foundation that does breast milk banking. It's a very new model to the African context, in line to the people down in the local rural villages to believe and accept that actually you can breastfeed from a breast milk bank. But these milk banks here are mainly in the urban settings and things like that. But when you look at the documentary about Ata Milk and all that, a lot of teenage mothers are going as clients to see that they get the milk as they continue with their school and things like that. I feel it's something amazing, in line to how breast milk banking is helping teenage mothers still see that their babies are fed as they go back to school and things like that. Over to you all.
Very important topic. Alice, do you want to add something?
Let me just add to say that that's a very important question, and it's a reality on the ground. So for me, teenagers are a very special group. It's a vulnerable group. So that is one thing we need to be cognizant of. So the approach comes from all angles. Number one, we have what we call the school health program. So the school health program would be able to pick problems of teenage pregnancy and encourage a situation whereby there is a teenage who is pregnant to be able to get antenatal care. So first of all, encourage them from that point where they are found. The next point is from the health worker perspective, so of the health facility level. So when we get these teenage mothers in our facilities, it is then the responsibility of the healthcare workers to recognize this is a special group that requires special care in terms of education, in terms of being sensitive to already the challenges they face. The other thing is at the household level. So at the household level, that is where we continue to have education. And if I look at the interventions we have at various levels in Kenya, we have what we call community health volunteers, such that now the government actually has elevated their role because they are very important. They are called community health promoters. So at household level, community health promoters visit the households and they educate the households in terms of the various interventions. We have had very successful interventions like family planning, immunization, teenage pregnancy. So this is an additional module that can be added into which is actually already there, but is strengthening that module for community health volunteers because they know the households. They know the household where the teenager, where there is a teenager who is pregnant. So they are able to follow up just the way they normally follow up mothers to take their children for immunization or to take the family planning. So the approach of supporting teenagers comes from various fronts. So from facility, household, community, even at the school level where we have the school health programs.
Thank you, Alice. Thank you very much. There's a question here for Nikola. It says, does health prioritizing come in play while framing ethics for breastfeeding interventions? Sorry.
Yeah, thanks a lot. I think this issue really refers to justice, which of course is a key concern of the framework. So it's really framed around the idea we want to respect autonomy of those who may participate in interventions. We want to minimize risks and burdens. We want to maximize the good that can come out of an intervention, and we want interventions to be equitable. So that's one of the key concerns that really goes through, or is really weaved into all of those principles, and most explicitly, I guess, in the principle that states risk minimization and equitable distribution of benefit and risks, and also in the idea of post-intervention support. So we do have it explicitly in the area of risk minimization and equitable distribution of risks and benefits under that principle, in that section of the framework, but also I think you can find it spread across the different principles because it's so key.
Thank you so much, Nikola. We have around 5 minutes left for the Q&A section, so we should start slowly wrapping up. I will ask a question that is an open question, so all of you can answer it if you wish. The question goes, how does the framework help protect especially vulnerable babies in breastfeeding programs? For example, preterm babies or babies with HIV-positive mothers. I remember Alice already referred to this issue in one of her answers, but maybe we can just talk a bit more about this, how this framework could help protect vulnerable babies in programs.
I think I was waiting for Faith because she works in a very busy hospital with vulnerable babies. So I look at this framework being useful in protecting vulnerable babies, which starts from ensuring that all interventions that address or target these vulnerable populations follow the ethical principles of this framework. And when this framework is also adopted or incorporated into the existing frameworks in our settings, for example, what the ethics review boards normally do is, if it is a clinical trial, if it is a study that is dealing on a particular drug, the lens is quite thick in terms of ensuring that the guidelines, the framework is addressed. So I see this framework really being useful because It allows now the research on breastfeeding for children with HIV to be well protected in terms of adherence, in terms of educating people who are using this intervention, in terms of sensitizing the health workers who are the ones who are normally the front line in terms of, for example, if I look at the facility where Faith works, the nurses at the facility level, I think for me, it is very important to sensitize them on this framework so that as they get a lot of intervention on that are addressing vulnerable babies, then they are clear that there is a framework that is safeguards or guides how this work has to be done. So I see that from the perspective of training and continue to have more and more health workers trained on this, particularly the frontline ones at various facilities. If I look at the Kenyan context from level 3, where we have, that is where we tend to have deliveries happen up to level 6, up to really high level hospitals like the big maternity hospitals. So that is where I see the framework working. Back to you.
Thank you very much, Alice. Faith Njeru, over to you.
Yes, thank you. I would like also to do an addition on the preterm babies. Preterm babies are vulnerable groups of babies, and also checking on the neonatal mortality and numbers of babies also bring into the highest number of neonatal mortality rates in the country, probably in Kenya, and therefore benefits and risk of breastfeeding assessment are very vital when it comes to the intervention, both in the mode of feeding and the breast milk substitute when it comes to deciding on which mode of feeding and which type of feeds that we are going to feed these babies. Most of the mothers who deliver preterm babies, within the first few days after delivery, they have difficulties in being able to optimize or to achieve enough milk to feed their babies. And then here comes where now the WHO guidelines says that the breast milk is the best feed for our preterm babies. And in an event where breast milk is not available or the mother's own milk is not available, then the donated human milk is the next best option for these preterm babies. And into the context probably of the place where I work, then this comes in line with the risk minimization when it comes to the feeding, in line to the public health ethics framework, where we also have a human milk banking department, and we also want probably to feed these babies with the donated human milk. And then here comes in when we also have to do screening. And for a screening also to be done and also to feed these babies then with another mother's milk, then an informed consent comes hand in hand. Yeah, so then I think also when also we are looking at the vulnerable babies and in line with the framework, then risk minimization, informed consent, and the issue of just a preterm baby being vulnerable, then I think this brings into the protection of these babies. Thank you.
Thank you, Faith. Thank you very much. Faith Nawati, do you want to add anything?
Well, I think Alice and Faith have said it all, and yeah, to save time, over to Nikola.
Nikola, is there anything you would like to add?
Maybe just a very general remark. I think these are great questions. I wish we could be sitting together in, a kind of a community hall and discuss those. I mean, you're raising such pertinent question regarding working mothers, teenage mothers, preterm babies. It's all great. How can the framework actually, what would the mechanisms be? How can they actually protect vulnerable groups? How can they, care for more, for well-reflected prioritization? These are all excellent questions. And I think it's delightful. I'm just very conscious of the fact we have a few minutes left, and I've been told we have 130 answers to the poll. And at this point, I'd just like to express my gratitude for raising those, for prompting, also for challenging us with your questions, for enriching our discussion. And I've learned a lot from your questions and also from my fellow panelists' replies. So thanks a lot.
Thank you, Nikola. So our Q&A section is coming to an end. I would like to thank our audience for sending us all these interesting questions. I'm really sorry that we could not answer them all. I am very grateful to our experts, Nikola, Alice, Faith Nawagi, and Faith Njeru. Thank you very much for taking the time to be with us today and for this great debate. And now I would like to hand over to Kai.
Thank you very much, Tania. It was an excellent discussion. So thank you everyone in the audience who participated, and thank you very much, dear experts. To those of you who would like to receive a certificate of attendance, please complete the feedback survey from the Global Health Network. You can find the link to it, and maybe Luz, you can post it in the chat as well. And the link is lactahub.org/certificate. Please indicate the workshop title, which is Public Health Ethics Framework for Breastfeeding Interventions. Otherwise, just write LactaHub webinar. This should be fine as well. And the code, which is the date of today, 1/8 for the 18th, 09, which is September, and 24 for the year. So 180924 when requested. The certificates will be sent to you within 4 weeks, so please be patient, but they will come. If not, contact us and we will take a look if they were lost somewhere in space. So again, thank you very much for joining this LactaHub workshop, and thanks a lot to the organizing institutions to bring to all of us this excellent webinar. As I've said at the beginning, this webinar is recorded, so you can access it afterwards on lactahub.org. And if you would like to provide any feedback on the webinar, please feel free to do so. The email address is contact@lactahub.org. Tania, now over to you for the closing remarks and for saying goodbye.
Yeah, I just want to thank you all again, and I hope to see you soon in our upcoming webinars. Have a wonderful afternoon or evening. Bye-bye.